Well, hello there, everyone. In today's video, we're going to answer the question, how do you enroll in a Medicare Advantage plan, also known as a Medicare Part C plan? And we're also going to answer the question, do you have to pay for Medicare Part B if you are enrolled in a Medicare Advantage plan? First, we have to start out with Original Medicare. So Original Medicare has two parts. You have your Medicare Part A, which is your hospital coverage, Medicare Part B, which is your medical coverage, and you get Medicare through the Social Security office. So you can either call the Social Security number, the 1-800 number, you can go to your local office and set up an appointment and such. So that's how you enroll in Original Medicare. And like I said, Part A is hospital coverage, Part B is medical coverage. So in order to enroll in Medicare Part C, you do need to enroll in Medicare Part A and B first, okay? So you have a 7-month window when you're turning 65 to go ahead and enroll in Medicare Part A and B. So like I said, you have a 7-month window. You have the month of your 65th birthday, 3 months before you turn 65, and 3 months after you turn 65 to enroll in Medicare Part A and B on time. Now, you can delay Medicare if you're working, but this video is not about that. Now, after you enroll in Medicare Part A and B, you could go ahead and enroll in a Medicare Advantage plan, also known as Part C. Now, Medicare Advantage plans have to be just as good as Original Medicare, so you do have to enroll in Part A and B to get a Medicare Advantage plan. So that is one of the rules, that you have to have A and B to get on C. So basically, a Medicare Advantage plan, also known as Part C plan, replaces Original Medicare. You still have Medicare in the background, but it does replaces Original Medicare. So you would be under a health insurance company, right? Such as United Healthcare, Aetna, Cigna. All these different insurance companies, they all offer different plans and benefits and such. A lot of individuals like to get on a Medicare Advantage plan because Original Medicare leaves you behind 20%. So what a Medicare Advantage plan does, it get rid of the 20%, but you have share of costs, you have copays. So the insurance company will pay its portion, and then you will pay your portion, which is copays. Copays go a little bit something like this. Usually it's like $0 for the primary care doctor, maybe $15, $20 to see a specialist, $100 a day for a hospital stay, $250 a day for a hospital stay, $50 for an ER visit. Preventative care would be zero, like a mammogram and such, right? So as you see, you pay as you go when you're on a Medicare Advantage plan. So it can be very cost efficient and very convenient, I would say, for a lot of individuals that don't want a Medicare supplement plan. A Medicare supplement is totally different. Now let's answer this question. Do you have to pay for Medicare Part B if you have a Medicare Advantage plan? And the answer is yes, okay? Yes and maybe no, and we'll talk about the maybe no. But yes, you do have to pay your Part B premium for Medicare Part B. Part A is usually free, usually zero, I should say. If you worked in the US, 10 years, 40 quarters, when you was paying taxes, you was paying into Medicare Part A. Now, when it comes to Part B, there is a monthly premium, and depending on your annual income, your monthly premium is based on a chart called the IRMAA chart. And we'll put up the IRMAA chart so that way you guys can see in 2025, the average individual would pay $185 per month, depending on their income. You could pause the video and look at the chart to see, would you pay the standard $185 or would you pay more and pay a Part D premium as well, okay? So like we say, you will pay Medicare Part B premium. However, if you're low income, you could apply for Medicaid, and Medicaid will pay the Medicare Part B premium for you. They're also called Part B Giveback plans, where you can get on a Medicare Advantage plan and they give back some of the money back into your Social Security check for Medicare Part B. And the Part B could be $50 up into the $100 or more for Medicare Part B, and that will reduce your Part B premium if you do get on a Giveback plan, okay? So if you get on a Giveback plan, then your Part B can be reduced, or you may not have to pay for Part B at all, depending on the amount the Giveback plan give. Now, there's a disclaimer when it comes to Giveback plans, and that is usually the copays will be a little higher when you're on a Giveback plan. You know that saying, there's nothing for free? There's nothing for free. So if you're getting on the Giveback plan, you're going to pay more for certain copays. So I definitely wanted to get that out the way. Now let's talk about particular Medicare Advantage plans. There's so many different options out there, so many different benefits and such as dental, vision, hearing, because original Medicare does not offer dental, vision, hearing. So these Medicare Advantage plans make these plans very attractive for individuals to enroll in their plans. So they offer things that original Medicare does not offer. Like I said, dental, vision, hearing, silver sneakers, which is like fitness benefits, transportation. So these are some of the reasons why individuals would get on a Medicare Advantage plans due to these extra perks and benefits. And like I said, you don't have to worry about that 20% that original Medicare leaves behind. Instead, you have copays, which is really nice. So there are two main types of Medicare Advantage plans. You have your HMO plan, you have your PPO. With an HMO plan, you do need a referral to see a specialist. You would get that referral from your primary care doctor. So you do need to choose a primary care doctor when you get on an HMO plan. Now with a PPO plan, you don't necessarily have to have a primary care doctor, and you don't need referrals to see a specialist. A lot of times individuals would get on an HMO plan because these plans tend to give you more benefits, more dental, vision, and hearing allowances, right? And with a PPO plan, these benefits tend to be a little less, but you have that option where you can see doctors outside of that network, and you don't have to worry about asking your provider for a referral. So there's a trade-off there because you have to kind of decide HMO or PPO, what's more important. And of course, when you're looking at these plans, you do have to get enrolled in a plan that is offered in your service area. So that is very important because that's going to determine your networks and doctor networks and all of that. So it does have to be a plan that is offered in your area. Now, when you're looking at shopping around for a Medicare Advantage plan, there is definitely a checklist that you want to check off, right? So let's go over our checklist. The first thing you want to look at is your doctors. Are your doctors in the network of this Medicare Advantage plan or these different Medicare Advantage plan options, right? So you want to look at your doctor networks, make sure all of your doctors are in network, or at least most of your providers. Don't forget your specialist, don't forget your eye doctor, don't forget your dentist. So you want to look at all of that, especially your primary care physician, right? So that's the first checklist. The next thing on the list is looking at your medications, which is very important, right? You want to make sure that your medications are covered. When it comes to Medicare Advantage plans, Medicare Part D, which is your prescription drug coverage, is usually included as well, right? So you want to make sure that your medications are covered. You want to look at the tiers of your medications. The tiers is going to determine the cost of your medications, the copays that you pay. So it's very important to look at your medications. The third thing on the checklist is looking at your preference when it comes to hospital stays, right? So what hospital is around you? You want to make sure there are in network. So you want to look at hospital networks. If you have anything special going on, and this is checklist number 4, if you have anything special going on, you definitely want to make sure that it's included, such as, do you have home health? Do you go to dialysis? All of those things is very important. And the last thing to look at is, of course, benefits. Okay, what's important to you? Is dental care important? Is eye care? How much are you getting towards eye care allowance, how much you could pay towards a pair of glasses. Can you get a pair of dentures if you need dentures? What if you need a crown? So those are the things that you want to look at when it comes to these extra perks. I feel like the extra perks are nice, but it should be the last thing on the list. The doctors, the medications, the special treatments, such as you have home health, dialysis, that is more important. Then you go down the checklist as I have stated. So that is how you want to shop around for a Medicare Advantage plan, okay? Now, how can you actually enroll? There's several different ways you can enroll. You can enroll via medicare.gov. You could go on medicare.gov, look at the different options in your area, put in your zip code, and you could search that way. You could call Medicare directly as well, and Medicare will help you navigate through looking through options. So that's another option as well. And you could directly go to these insurance companies and call them up and say, hey, I want to look into your plans. Okay, so those are the three options that you have, but there's a better option. There's a better way, and that is working with a broker like myself, working with a company that is great when it comes to customer service, support. When you work with an independent broker, you have that extra support. So you have the support of that insurance company, and you have that extra support of working with an independent broker as well. Someone that would be there for you along the way. That's what our company does. We will be there for you when it comes to having questions, helping you navigate through all of the maze of Medicare, and helping you find a plan that is tailored to your particular needs, okay? You don't want to just get on a plan because, oh, my neighbor loves this plan, or, this person loves this plan. You really want to get on a plan that works for your particular needs, and that is exactly what we do. And we give our clients customer service all year round. So it's really nice to work with an independent company like our office. If you need any assistance, give our office a call. We'd be more than happy to assist you. We'll be happy to have you as part of the family, okay? Thank you so much for watching this video. If you have any questions, comments, concerns, definitely leave them in the comment section below. If you know anyone that need help with any of these services, then definitely share this video with a friend. Thank you so much for watching, and I'll see you on the next video. Bye for now. Bye.